Welcome everyone to our last ground rounds of 2024. My name is Marielle and I will be your host for today. And before we start, I'd like to go over a few things. This presentation will be recorded and uploaded to our YouTube channel and Figure One account. To access the PDF version of this presentation, please click the link included in the invitation sent this morning. And to register and join our Figure One page, please use the link in the chat box that I will put in a minute, or the QR code included in the invitation. And for our audience, you may turn on the feature called Caption on Zoom during the presentation to allow for subtitles. And with that being said, I would like to hand it up to our medical director, Dr. Pecchia, who is also one of our presenters today.
Great. Thank you, Marielle. Great to be back, and I appreciate the introduction, and excited for what we're going to see today. And I'll introduce our speaker in just a moment. I'm Greg, family physician, geriatrician, and medical director for a few years now, global offsite care, which most of it was dedicated to supporting telehealth and telemedicine to the underserved globally. With that, I'd like to introduce our speaker today, Anna Joseph. She is the Senior Community Operations Manager for Figure One, which is now an operating unit within 4Medics. She'll explain what her company does and why we have her here today. But short of that, we know that she's been working with them since 2016. And in 2021, Figure One introduced a new and improved platform designed to provide a safer environment for healthcare professionals and students to share medical cases, which is a really core deliverable of what we do at Global Offsite Care through these global ground rounds. And she'll encourage you to join the platform, as do we, and is happy to assist you along the way. Her contact info will be provided as part of this. And a fun fact about Anna is that she's hiked the Kalalau Trail in Hawaii, which is often regarded as one of the most dangerous hikes in the world. I looked at it myself last time I was there, and I agree. Looks pretty darn dangerous. In fact, so much so that I said thanks, but no thanks. So kudos to you, Anna, for that accomplishment. With that, Anna Joseph.
Hi, everyone. Very nice to be here today. And yeah, it was a challenging hike. Let's talk a little bit about Figure One. I will share my screen if that's okay. This is the Figure One platform. Figure One is essentially a platform for healthcare professionals and students enrolled in any healthcare program to share medical cases. It was founded by internal medicine physician here in Canada. And the reason why he decided to create this tool was because he had a patient at the emergency room who was having symptoms that they weren't sure what was happening. And based on the case description, they realized they should reach out to somebody in the Amazon because the patient had been to the Amazon a few weeks before she presented to the ER. And by the time they were able to contact somebody in the Amazon and figure out what was wrong with the patient had passed away. So he thought there should be an easier way for me to reach out to colleagues in different parts of the world, because for them, it was very easy to identify what the patient had. I shouldn't have to go through so many different ways to find somebody who knows exactly what my patient had, and maybe I could have saved this patient's life. That's why he came up with the idea of creating a platform for healthcare professionals to collaborate. Figure One is a free platform anybody can join, and it's in more than 180 countries. So it's basically available all around the world. So I will present what we have here on Figure One, and we'll talk about the private group for the global grand rounds. So the private group, as the name suggests, it's only for members. You have to use the link to join the group. But when you sign up for Figure One, you can also use the general public Figure One, which is the one that we see right now. A couple of things that I wanted to mention about the way the platform works. And like Dr. Pecchia mentioned, we improved the way the platform works in order to make it safer and more secure for our members. So what that means is all members who join Figure One, they go through a verification process. And what that means is when you sign up and you select that you are a healthcare professional, whether you are a physician, a medical resident, a registered nurse, a physical therapist, you are required to upload a diploma, any credentials, any official document that we can use to confirm your name and your profession. If you are a student, we ask for a proof of enrollment or a student ID. And the reason why we do that is to confirm that people who are joining the platform and collaborating, they are who they say they are. We know that the past few years, we've had so many TV shows about medicine and people are very interested. So we know that people want to join. So we try to make a safer platform for those who are actually engaging in sharing medical cases, that they are in the medical field. The other part of creating a safe platform is ensuring that no patient information is shared. We know there are very different rules depending on the country on how patient information can be shared. In order to make it easier for everybody who decides to share a case, we simply do not allow any patient information. And how we do that is every case that is uploaded to the platform, it goes through a moderation process. We ensure that the case is actually a medical case, it's not a spam, that it doesn't contain any patient information, that it is a relevant case to the community. We have a few guidelines that we follow to ensure that the cases that are presented to the community can be shared in a social platform. So those are the ways, briefly, that we ensure that we have a secure platform for those who join. And if you have any questions about the moderation and verification processes, feel free to reach out to me. So I will talk about what we see here, which is the main feed. So basically, the feed, when you sign up, you will get a regular feed similar to what on different social platforms. And this is curated based on your medical specialty, if you selected one during your account creation. But you can also come here to your settings and you can select your interests and you can populate it with as many medical specialties you would like. And when you do that, you go back to your home feed and you will see cases that match your interests. When I go to and just to briefly explain, when you click, you just open that case that you clicked. So we can see the person who posted here, their medical specialty, the image, the case description. We do have some labels that we'll talk about when I upload a case. But this is an unresolved case. They're asking, how would you read this film? What would you suggest? How would you manage? And over here, we have the discussion. So these are members of the community. This is the public Figure One community. And we can see here, they're either their medical specialty or their profession. So when you see a medical specialty, it's a physician. And when you see a profession, it's that profession. So we can see here when the author is posting a comment, it's labeled as such. So you can go through and you can sort the comments based on when it was posted. To go back to the main feed, you just go back. So that's how you basically navigate the main feed. Over here, we have different feeds, as we call them. So this is your main feed. When you go to home, this is your main feed. And again, it's based on your interests. Over here, we have all our quizzes. So every week we post a new quiz. I'm not sure if we're doing one quiz a week or two, but we usually pull a case from the community and we use it to create quizzes, sorry. So you can go through all of them and you can test your knowledge. And when you click on one of the options, then you can see how many members selected that same option, what is the right option, and the answer. So this is a quick way to test your knowledge. The other two main feeds that we have are cases based on recencies. New cases always appear at the top. And the trending, so that is based on how engaging a case has been. Okay, let's talk about groups. The reason why we're meeting today is to talk about the Global Grand Rounds group. When you join Figure 1 and you use the link that was provided in the invitation, or I think it's here in the chat, if you're not a Figure 1 member, you have to go through the registration process like any other member. But when you finish the registration, you will land in the Global Grand Rounds group. And this, again, is a private group. Only members who have been invited can join the group. And right here, we can see all the cases that have been shared already. For example, this case was posted. This was the latest case that was posted. And you can go through all the images here. You can read the description. You can click the link to view it on YouTube. And you could also participate in the discussion over here. So if I had something to say about this, if I had a question, I could post directly here. And I can see that I'm posting my comment to the group because it says add a group comment. I can go back and I can continue to scroll through the other posts that have been posted to my group. I can be a member of several groups, and they will all appear here on the left. The experience on mobile, it's similar. So let's try to create a case. What do you think, Dr. Pecchia?
Let's do it.
Okay, so as a member of Figure 1 and the Global Grand Rounds group, I'm not sure if what I'm going to say right now is correct, so correct me if I'm wrong, Dr. Pecchia. Anybody's welcome to upload cases to the Global Grand Rounds group. Is that correct?
Absolutely, and we'll talk about how important that is to the medical community globally, and this small part of it, or becoming a significantly larger part of it, but also the importance of to our mission at Global Offsite Care for 24/7, 365 collaboration on cases, as well as the ability to deliver continuing medical education credits for that activity and that collaboration, as well as immediate access to all of your archives of pertinent information and continuing medical education credits. So I'll ask about that and mention that a little bit later in the talk. Yeah, have at it. Looking forward to it.
Okay. Let's say I am a healthcare professional. I'm part of the Global Grand Rounds group, and I want to share a medical case because I'm not sure what's wrong with my patient, and I want some feedback from the community. I can just come here to create a clinical case. And because I'm a member of the Global Grand Rounds group, I can select the group here. If you can also select to share with the public Figure 1, and that means you're sharing with the whole Figure 1 community. Right now, I'm going to select the Global Grand Rounds group. I'm going to upload my images. and I can select up to 5 images. And you can see here that I have a pencil icon. And if I click here, I can use any of the options that we have here. So let's say if the patient had a tattoo here, and a tattoo is considered a patient identifier, I could just, let's say, come here. I could select a circle. Let's do, I guess you can see I've never really used this tool here. Huh, interesting. I could actually just do this. This would be the easiest way. And I could block it. After I'm done blocking any patient identifiers, I can just save it and you can see the image has been updated. And then I can go through the different images here and see if there's any other patient identifier that I should be removing. After I upload my images, if I have images, I can enter a title here, patient case. Let me copy the description. So I'm just saying a 60-year-old female presents with the lesions above. First was on her finger, possibly related to a cat scratch or a sore throat. Lesions don't hurt, but they make the fingers feel tight, no fever, normal biochemistry. Does anybody recognize the lesions? I'm going to select this, and these are optional, but I'm going to select this as a common presentation, and this is unresolved. This could be infectious, dermatology. I can select up to 10 specialties that are related to the case that I'm presenting here. And I'm going to submit. Once I submit the case, it will technically disappear. But what it means is it's now being placed in our moderation queue. And what happens is our moderators will go through the images, the case description, and make sure that everything looks good and that it can be presented to the community. And once your case is approved, you will get a notification saying your case has been approved, and it will also appear here at the top. So if the moderation approved the case that I have presented, it would just appear here at the top. So that's how our case upload process works. The only thing I wanted to mention is we have 2 options here. So one is a clinical case, and that basically means a patient case. For a post, if you see an article that you think it's interesting, or you have a general question that is not patient specific, you can select the post option, and they're essentially the same. You can also select to share it with the global Grand Rounds group. You can just type in your question or add the link to a research that you read that you found interesting. If you have images, you can upload them here. You would select the specialties the same way we did in a previous example, and you would submit. And that would also go through our moderation process. Here's a quick link to our posting guidelines. And if you were uploading a case and then you have to do something else, or you're not ready to finish it, you can always save it as a draft, and it will, I have to upload it, but it would live here, and then I could just, let's just do a test. So it lives here, and I can just come here, click test, and then continue uploading my post. Do we have any questions about the upload process?
How is this financed?
So we have sponsored content on Figure 1. We only do educational content, and that is how Figure 1 generates revenue.
Okay.
Because I'm not a physician, I don't have any sponsored content on my feed, but that's how we generate revenue.
Okay.
They look
Yes,
similar.
I
Yeah.
have a small question.
Sure.
Yes, thank you. I'm Dr. David Otto from Kampala, Uganda. Yes, my question is, so how do I share or how do I invite Figure 1 friends? If I have friends whom I want them to join and maybe be part and parcel of a group, for example, the Global Offsite Group, and I have colleagues whom I feel will be beneficial, how do I invite them to join? Is there a provision for me to share the link or something? Yes.
Now I'm not sure if anybody's invited to join the Global Grand Rounds group. If that's okay, then you can just share the link that was shared with you via email. But if you just want to invite them to join you on the general Figure 1, you can just click here, invite colleagues, and you can enter their email address here, or you can copy the invitation link here. And then when you copy the invitation, then you can just send them via text message or WhatsApp or email. So you have the option to enter their email address here. You can copy the invitation link. And when you do that, when they use your link, once they finish this link here, when they finish the registration, they should land on your profile page, which, for example, in my case, it would be this one. And then that would be, let me open, let's say, I think it's just, let's say the person invited me to Figure 1. Just a little longer. Okay. So if I used their link to join Figure 1, I could just come here to their profile page and follow. So when I follow somebody, every time they upload a case, they take an action, I get a notification, and notifications live here. So every time they upload a new case, I would be notified, and then I can just come here and see what they've uploaded. For the group, if you want to invite somebody to the group, and I'm assuming that's okay, Dr. Pecchia and Marielle can chime in. You can copy the invitation link here. You can select the options here as well.
Yeah, absolutely, Anna. Right, that's an open invitation for a number of reasons. And yeah, I appreciate the walkthrough on this. Hopefully, Dr. Otto, that helps, because absolutely would love to be able to see some networking coming as a result of this. Always available, easy to use, 24/7, 365 way of collaborating, which kind of opens up what we do here at Global Offsite Care and the Global Ground Rounds to an always open and a never closed collaborative environment. Yeah, this is super helpful, Anna.
Just a couple of quick ways that you can also invite somebody. If you see, for example, a case that you know somebody would either love to see this medical case or they can help, you can use the share option here, and that will let you copy a link, and then you can send the link to somebody. If they're not a Figure 1 member, they will have to register if they want to comment. But if not, if they're not a member, they can still see the case. I think we have a limit of 3 cases that we let the same people see without signing up. But that's also a way to share cases. ways that you can also collaborate instead of uploading a medical case, you can post a comment on a case, whether you're asking questions or making suggestions. You can also go through the comment section here. You can read all the replies. And if you have something to add, you can add a comment. And I just want to highlight that right now I'm on the public figure 1. So that's why it says public comment. When I'm in the group, it says group comment. So this is a easy way to know if you're in the group space or the public figure 1 where everybody is part. Another way that you can participate if you don't have anything to add or to contribute to the conversation here, you can always just like a comment, and that just shows some appreciation to the person who's posting it. We know it's not an easy task for people to upload content. Whenever you see something that you enjoy, you're welcome to just like it if you don't have anything or if you don't want to contribute. Another quick way to engage with a case is to save it. And if I see this case, let's say, I think this is interesting, but I don't have time right now to review it, I can save it. And then it will live here on my saved cases after I refresh it. So right now I have over 500 saved cases, but then I can easily just go back and review it whenever I want. I think lastly, we'll talk about the education area. And this is where our CME activities live. So you can come here. This is available to everybody. So you can complete all activities that are listed here. And when I open an activity, I can see some of the information here, and I can see that this activity has a 0.5 credit. These are activities, they are accredited by MedChi. So what happens once you finish the activity, you can download your certificate. Let's exit. And all my completed CME activities live here in the completed area. And I can see how many CME credits I've earned so far, how many I've earned this month. And I can download the certificate. For members who are not in the US, because they are accredited by a US-based company, you can just take your certificates and bring them to your institution, to your medical board, and there's probably a way to convert those credits so you can use them in your country. This is basically how it works. If you have more questions about our CME activities, feel free to email me. I'm not the expert in CME, but I'm happy to answer any questions you might have. But this is where you would go to complete and obtain CME credits.
Question, Anna.
Sure.
Yeah, and reminding the audience, pose a question, a comment at any time. Certainly encourage that. One that comes to mind here is perhaps if we're going to be seeing a how-to, maybe posting a case in particular, if you could then demonstrate for us how one obtains CME credit for either posting or collaborating on a particular case that may be posted either in our private community or the Figure 1 community. Yeah, just wanting to be sure everyone knows that your activity is not only for your benefit, but also the benefit of everyone else who's participating in the community. And as such, we want to be sure that you have full capability to get credit for that. So if you so choose. And then also maybe a comment about other healthcare professionals other than physicians who might also be interested in participating and how they do that.
So any healthcare professional can join Figure 1 and participate as long as you're a verified member of the community, which means when you create your account, you upload your credentials. Our verification process takes at a maximum 24 hours. So if you haven't heard back from us in 24 hours, it probably means that we need more information, and we've sent an email to you asking for more information if you did not upload a document where we can confirm your name and your profession. So anybody who works in healthcare is welcome to join. In terms of getting credits for the cases, we only have credits, and those are CME 2 credits, but that's at this time only available to US based members. The credits that you can obtain is through the education tab. By sharing medical cases, we don't provide credits for sharing medical cases at this time.
Great. And then I see on the screen, how does one find a medical case? Let's say chest pain, just queuing on to, right, a case such as chest pain. I see, searching in the Figure 1 search bar up there in the upper left-hand corner. There you go.
So let's see. This one here. So I can select, and from here I can go through again the image, a very brief case description, and then I can go through the comment section here. One thing that we implemented with our new platform in 2021 was the creation of a similar cases. So if you're looking at an ECG and you feel like looking at more ECGs, then you might just go to the next case, and then you can continue on the rabbit hole of ECGs.
And it looks like each of these cases then also qualifies for CME. So if the user wishes to at least document that they looked at that case, they benefited from it, and then they do, if I remember correctly, a little Q&A, maybe a few questions to fully document their participation. Is that right?
Yes, but that is only available to US based members at this time.
Yeah,
Right.
Can you demonstrate that, please?
Let me see if I can change my country because I'm not in the US. But let's see if I can update my profile so you can see. I'm not sure if.
Well, just show us.
I'm just thinking if any type of self-documentation would be accepted by different medical boards. If that's the case, I'm happy to send the questions, but that would have to be self-documented.
On it.
Let's see if that worked. Oh, I know why. It's because I'm not a physician.
There we go. But Dr. Falk, what you would see is an additional, there we go.
Yeah, it's this.
That's it. Yeah, you've done the case, and then you choose to obtain the CME, and for Anna, for non-US based clinicians, do they, if they're from outside of the country, if I get it correctly, then they can take that activity to their own CME process, and then it would be up to them in country to then see whether or not that qualifies for the requirements for their own CME. Is that right?
Yeah, that would be for the activities that they complete here on the CME area. Before I changed my country and my profession to physician in the US, I didn't have this option here. So
Right.
unfortunately, at this time, this is only available to those in the US, but I'm not sure if you can self-document that you've reviewed this case and you complete the questions that are here. Let's do like test. I select here research activities, and then let me move this out of the way, the changes. And if I do here and I submit, because I changed my profession in my country to physician in the US, then I could get the credits here.
Okay. Yeah. So in our follow-up, we'll send out some reminders for those who are outside of the US in terms of their licensure and or their residence about this process. So make it simple and straightforward for everyone. I appreciate that. For those who are actually in the US, if they make that claim, if I think what we saw, it just involves answering a few questions to certify that you had the activity, and then there's a certificate available to archive, print.
Exactly.
Etc.
Dr. Pecchia, I have that emergency medicine case open here.
Let's do it.
Okay. So this was a case posted by a paramedic. As you can see, anybody who is a healthcare professional, whether you are actively working as a healthcare professional or if you were a medical professional in the past. So we welcome retired healthcare professionals as well. You're welcome to use Figure 1. And in fact, we have a good chunk of our community they're retired healthcare professionals. How do you want to do this, Dr. Pecchia? Do you want to go through?
I'd say, yeah, you can just go ahead and present the case just as it is real quickly, and then how a user would typically interact with it if they wanted to make a question, participate in a dialogue, and then also when they're finished, how they would be notified when the case is finally resolved, and then how they might get some CME as a result.
Okay. So this paramedic here had some images here, which they're describing here in the case description. This is, for example, a way that we identify anybody who's over 89. Posting the exact age of somebody who's over 89 is a patient identifier. So this is the way that we allow the age on Figure 1. So they are describing their symptoms, some additional information here, their medical history, some lab findings. And they selected to post, this was a resolved case. So cases on Figure 1, they can be resolved cases. You know what the diagnosis is, the outcome, but you think this is a great way to share knowledge with the community because there's an interesting insight. So you can share that with the community. The other main reason why people post cases on Figure 1 is when you need help with something, and that would be a unresolved case. We have a special area for the diagnosis, and that is because if you were trying to read the case and figure out what the diagnosis is, it's not right there available, and you have to click it. So if you're trying to guess what the diagnosis is, you can do so without reading the answer right away. So this is the final diagnosis that they posted. I'm not sure when they posted this diagnosis, so it could be that it was after the discussion here. And you can see there a lot of information from the author, and you can see the conversations happening. You can hide or view all the replies, and up here, I have the tab selected by physician and by all. And if I'm participating in this conversation here, every time somebody posts a comment, I will get a notification. So I know there's something new in the conversation happening there, that I can just click on my notifications that I can either get by email or by push notification if I'm using Figure One on my phone. And I can just click the link and the case will on my device. After I read the conversation here, I can select to reply to this particular member, or if I have a new insight that hasn't been posted here, or if I have a question that shouldn't be a reply to somebody, but a comment on its own, then I can just select to post it here. And I can type in my comment. And after reviewing that again, I can select to get credits over here. And this is another thing that I can do. I can go to this person's profile page and I can select to follow them. So every time they upload a new case or they take an action, I can get a notification. And I can see here, if I like the style of the cases this person presents, I can go through the other clinical cases that they have shared with the community. One thing that is important to keep in mind is cases that are posted to the group, they will not appear. When I go to somebody's profile page, I will not see their cases here. And that's because cases that are posted to the group, they are posted to only certain members of the community, not to the general community. So we don't display cases on profile page, cases that have been posted to a group. So to see cases that were posted to the group, the best way to do it is by going to the actual group. I hope that makes sense.
Yeah, absolutely. Yeah, we have a actually posted question, Dr. Falk, asking about the turnaround time when you post a troublesome case. And this is really, I think, pertinent to the reason for some turnaround time is for your staff to be sure that the case is fully de-identified and also is appropriate in the event that there's some either inappropriate imaging or patient specific information. And so what's that typical turnaround time?
So we have moderation shifts every hour from 9 to 6 p.m. Eastern time. We're constantly checking the moderation. And one thing that is only if you have an urgent case, and this feature is only available to the public, Figure One, is when I'm, so this will not be an option when I'm uploading to the group. When I'm selecting the public Figure One, and I have an urgent case, I can select that this is a case that I need help with. And I can select the option, I want help with this case, and I want to page specialists. When I save this option, and I think this is a abdominal imaging radiology case, for example, and I need somebody to review this case right away, I submit it. As soon as the case is approved by our moderation team, because I selected I want to page specialists, we will send a notification to our members who are specialists in radiology and abdominal imaging. So the specialties that I selected here. One of the areas that we work on during our moderation process is also reviewing the specialty. So we might, if you selected an incorrect specialty by any chance, or if we think more specialties should be paged, we can add specialties as well to your case. And that will send a notification to our members in those specialties. And let me see if I can find a paging case that was uploaded recently.
But how long does that typically take?
So if everything looks good from a moderation perspective, it should be approved within 1 hour
Okay.
if it's uploaded during 9 to 6 Eastern.
And how long typically then do the specialists take to respond? Can you answer that?
If it's a specialty like family medicine or dermatology, where we have a lot of members in those specialties, then it's usually within minutes we would see a response. If it's a specialty where we don't have a lot of members, such as nuclear medicine or maybe rheumatology, just because there's not a lot of members, then it would probably take longer. But that's why we also review, I don't see any recent paging cases, but it has a flashing alert, like the alert emoji with the flashing red light. So it's very easy to see, to identify.
And what happens after hours?
Then we have moderation sessions around 8 p.m., 10 p.m., all Eastern, and then again in the early hours. And that's how our moderation process works. Let me do one thing, because I want to show what it looks like when your case is not approved. Let me reject that case that I uploaded so you can see what it looks like when our moderation rejects a case. Okay. So I should have received, you can see my screen again, right?
Yes.
Okay. So I received a notification from the moderation saying this case requires editing. And when I click here, I can see the message from the moderation saying, please include more clinical information in the case summary. Obviously, this is not a valid option for this case, but this is because I included a lot of information. But let's say if I had just posted a question mark with the images, this would probably be a valid rejection from our team. I want to say that we are more lenient with cases that are posted to the Global Grand Rounds private group, and that is because it's a different scenario. When we are reviewing cases that are posted to the general community, then we want to make sure that there's more information, because it's just being posted to the broad community. Because this is a private group with members that are used to talking to each other and you have a relationship, then we're more lenient with the type of information, because we know there's an interest behind getting that case solved and helping the patient.
Great. Thank you, Anna, for that. By the way, how many users globally are part of Figure 1 currently?
Oh, I would have to check.
I
think right now we have like active members. I think we have around 200,000 active members globally.
Okay. Yeah. And Dr. Falk, my experience with posting a case to a specialty has been, along those lines, more common specialties, cardiology, gastroenterology, general surgery, et cetera. Those have been on the order of sometimes hours, sometimes days. And if we have an emergent case, clearly, probably first place to post wouldn't be here, but to deal with the urgency of the case. But if it's appropriate with that time frame, then this is an opportunity not only to gain some understanding for cases that sometimes are confounding or difficult to navigate, as well as to educate pretty much simultaneously, which is one of the reasons we were so interested in developing this relationship, the global offsite care, to support global ground rounds, and to be able to make it simple, easy, fast, at any time of the day, anywhere, from anywhere in the world, with, of course, some bandwidth and internet access, to begin to collaborate both internally and also to gain some access to the experience and expertise of the other specialty users that are part of that 200,000 user group. Okay. We have a couple of more minutes left in our hour, and any other questions, concerns, comments before we wrap up? I think a reminder, Marielle will probably mention that it's a QR code to make it all simple. If you lose access or forget how to access Figure 1, sign up with it, any of the steps that were mentioned today, there is a QR code on the invitation and it will be on our website as well. One last question. I know confidentiality, not only for patients, but for users comes up. What about those email addresses that are used for registration, et cetera? Are those kept confidential by Figure 1? Should we have any concerns about ending up on a mailing list or worse?
No, we don't sell our information, and we have all the technical infrastructure to keep that information safe. You also have the option when you sign up, you have the option to opt in to our emails where we might share cases that are trending or that we think are interesting. And you always have the option to update your subscription. So yeah, that's all done by default. If you want to delete your account, your information will be removed. So all that good stuff.
I want to thank you for helping us understand this powerful collaboration environment, and also to your leadership and your entire team, and looking forward to advancing forward together and how to make the world a better place, and in particular how to leverage some of these new technologies to get better access to care for more of our fellow citizens and cohorts across the globe. So I will hand it back to Marielle to close, and thank you again, Anna.
Thank you, Anna and Dr. Pecchia, for walking us through Figure 1. And for the audience, if you'd like to refer back to this presentation, this recording will be uploaded to our YouTube channel, or you may access the PDF version of this presentation using the link included in the invitation sent this morning. And to register and join our Figure 1 page, please use the link or the QR code included in the invitation. I will also try to include the QR code on our website so you can visit our Global Gun Rounds webpage. And if you have any questions or any inquiries, please use the email in the chat box to email me. And with that said, our next Global Gun Rounds will be on January 8th. And as always, we appreciate your interest and continued participation. And thank you, and have a great rest of your day.